Back to the pain patient for a moment. Do you have stories of patients that were dependent on drugs for many years, and under your care you've seen them off and feeling better?
Absolutely.
Without pain?
I've had patients
Really?
that have been coming to me that have been taking non-steroidal anti-inflammatory drugs for years. Several chiropractic adjustments, gone. Patients with headaches, taking aspirin
Combined
every day.
with nutritional therapies.
Adjustments, food allergies, nutritional supplementation. Food allergies is a big thing. So that's one of the major testing that we do in the office is we
Food
look
allergies, how does that, but is that your role as a chiropractor?
Well,
Dealing
again,
with pain.
if I don't do that.
Is it connected?
Absolutely. And this is the connection, all right? Every time you eat food, it breaks down into not just protein, carbohydrates, and fat, but thousands of messenger molecules that get absorbed through your digestive tract.
Okay.
Now, sometimes your gut is a good barrier, and sometimes it's not a good barrier. It's been damaged from years of abuse, coffee, stress, poor diet, antibiotics. Kill off
Okay.
the good bacteria. Your digestive tract becomes more permeable. You eat food, certain things go into your systemic circulation. Your body recognizes them as an allergen. You create these inflammatory immune complexes that attack your joints or attack your thyroid. So we look at these autoimmune disorders are often caused by what people are eating.
So it's all connected.
It's all connected.
And it can relate to pain.
And relate to
End up
pain.
in pain.
So it's remarkable, Randy. We do a food allergy profile test with Metametrics, which is a great lab in Georgia. We have a lab draw blood for us. We send it overnight, and we get a beautiful report that comes back with about 100 different types of foods that this patient has been subject to. These are the most common foods. And you'd be surprised what you see people come back allergic to.
Now, supplements, by the way, a word on supplements. Not all supplements are created equal.
That's true.
According to you.
And there's a tremendous misnomer out there. Perfect example, patients think that all vitamin E's are created equal, or all vitamin C's are created equal, or even worse, all fish oils are created equal. So I've done my homework, and I make sure that the products that I use are the highest quality products in the marketplace. And there's a tremendous difference between the physician marketplace of nutraceuticals and nutrients as compared to what you're going to get at a Costco.
Number one brand, Centrum. What's your view on that?
First of all, there's no such thing as a good one a day, and I would call that a Flintstone vitamin for adults.
Okay.
First of all, we look at the key raw ingredients, and all the minerals that I use in my nutrients are true dipeptide amino acid chelates.
What does that mean?
That means that you have an amino acid that's bound to a mineral on both sides, and it gets absorbed through the amino acid receptor site on the cell, so you get much better absorption instead of taking an inert, inorganic form of a mineral, which doesn't get absorbed.
Would you say not effective?
I would say very ineffective. And
Waste of money? Like
yes,
a Centrum?
Yes, I would say it's a waste of money, nutrient, and that money can be much wiser spent on a high-quality nutritional
A
supplement.
lot of confusion, I guess, about nutritional supplements.
That's true.
What do you do to eliminate that confusion?
Well,
I mean, you offer several different brands, or what do you do?
I use the best of the best. I've done my homework. I've researched out through seminars and through educational institutions such as the Institute of Functional Medicine that we have really brought the best nutrients into our practice.
Since you started, would you say that there's a growth in chiropractic? More people are more accepting of it. The mainstream. I know medical doctors that I interview on the show, they recommend chiropractic. I mean, is that what you see?
Absolutely. Chiropractic has been around since 1895. It's the largest natural healing art in the United States that's grown a tremendous amount. I mean, you look at people like Tiger Woods, one of my favorite, Lance Armstrong. In his last book, I think it's called Every Second Counts.
Sure.
He travels with a chiropractor. The U.S. Postal
right?
team travels with a chiropractor, and they says it's one of the most important people on the team. You know, you ride 130 miles every day for a 2,300-mile race around France, you need a chiropractor. But they do it not necessarily because they're in pain, they do it because they want to stay at peak optimal performance. And that's the beauty of chiropractic. It makes sure that your spine is in proper alignment, you take the pressure off your nervous system, and then your body works better. A very key point, and a lot of people don't realize this, but the nerves that come out of your spine go to every single organ of your body. So what does that mean? The nerves that come out of your neck, they go to your heart. The nerves that come out of your mid-back go to your stomach, your liver, your gallbladder, your pancreas. The nerves that come out of your low back, they go to your large intestine, they go to your prostate. They go to all the female reproductive organs. So if you get a bone that's out of alignment, in chiropractic, the million-dollar word is called subluxation. If you have a subluxation due to physical stress, chemical stress, or emotional stress, you can cause those bones to shift and move out of alignment, put pressure on a nerve, choke that nerve, and interfere with the nerve flow wherever that nerve is going. So chiropractic has definitely grown. I've seen it work.
Are you seeing more and more healthy patients? For prevention, go to see you.
I think at this point, most of the patients that we do come in, they have an issue. But once they learn, they get past that point and they understand the benefits of chiropractic care and the type of care that we offer them through nutrition, diet, and lifestyle counseling and very specific target nutrients, that patients come in to stay well.
What do you want people to know about what you're doing at your center?
That it's much easier to stay well than to get well. And what I mean by that is that the medical model is patients have gone to doctors only when they're symptomatic.
Okay.
We'd rather see patients when they're feeling good. Let us take a look at your body composition. Let us take a look at your blood markers. Let's do a urine analysis test on you and see what your insufficiencies are, and then bring you back to optimal performance. Because, you know, perfect example, if 125 is considered the normal for blood sugar, and if you're 126, you're diabetic, and you're 124, you're normal, it's a continuum. So I'd much rather keep patients at 70 to 75 for blood sugar. Most patients are not like that. They're in their 80s, they're in their 90s, sometimes they're in the 100. And doctors will often say you're okay because you're below the normal. All right, you see what I'm saying?
Sure.
But you don't want that. You don't want those markers to be high. You want to be able to bring them down and get them into a very small range of acceptable.
Reading the list of what you do here: chronic fatigue, fibromyalgia, all the same approach?
You know, again, it's patient-centered, so everybody's a little bit different. And you can't put everybody into a box and give them a diagnostic code and then this is the treatment. So a lot of times with fibromyalgia patients, it could be mitochondrial insufficiency.
What is fibromyalgia, by the way?
Fibromyalgia, fibromyositis, is inflammation of the fibrous tissue of the body. Again, so here's that key word, inflammation. But
so they're in
patients,
pain, though?
They're in pain because they're inflamed. But they can be inflamed for a couple of different reasons. They can be inflamed because they have mitochondrial insufficiency, which again is the battery of the cell, and there could be things interfering with that. They could be toxic. And one of the,
toxic, how so?
Well, when patients come in, we really will do quite an intake on them, and sometimes these patients need a gastrointestinal and liver detoxification program to start first.
You have that.
So we'll take them off bad food, and we'll introduce good things into their body and put them on a very specific detoxification program with emphasis on liver, gallbladder, and gastrointestinal health, which is key, Randy.
What are the programs you have?
We have programs for diabetes, pre-diabetes, which is syndrome X or insulin resistance, programs to prevent breast cancer and prostate cancer, programs to lower cholesterol naturally, lower triglycerides, lower high blood pressure or hypertension, programs to lower weight, pain and inflammation programs, programs for fibromyalgia, and one of my favorites is programs really to reduce neurological degenerative decline. And that is to reduce the risk of Alzheimer's disease, Parkinson's disease, MS. Alzheimer's disease is a preventable disease. It's a disease of lifestyle.
You're convinced of that?
Absolutely. The research is absolutely out there. Patients, I mean, you might have a genetic predisposition to become an Alzheimer's patient, but how you treat your genes during your decades of living will determine if those genes will unfold or be kept dormant. And I will help patients to be able to determine that. So that's really one of my favorite topics, is to prevent that neurological decline.
Now, again, the critics watching this may say, well, this is outside his area of specialty. What do you say to them?
Well, I've averaged about 100 hours of continuing education credits per year in the field of chiropractic and nutrition. So I would say to them that I am on the top of the game when it comes to the latest research in the medical literature. I'm talking about the Journal of the American Medical Association, the New England Journal of Medicine, the peer-reviewed journals that have this literature, that talk about CoQ10, that talk about the benefits of fish oils.
You say it's evidence-based. What does that mean?
Evidence-based, that means that there have been studies done in the medical literature that prove what I do in my office. Everything is substantiated.
Now, what if somebody watching this also is fearful of you taking them off their drugs? Because you have a natural approach.
Well, I'd like to say that I am not personally going to take them off the drug. They need to work under the guidance of the doctor that wrote the prescription to get them off. Now, they can say, Doc, I'd like to be off these drugs. I'm going to try some nutraceuticals or nutrients at this point, and I want to be closely monitored. So,
is it a cold turkey approach oftentimes? I mean, you work together with a medical doctor.
That's true.
Or do you wean them off slowly?
You have to be weaned off most drugs. Most drugs have a half-life. That means that a drug will stay in your body. If 50% of the drug will stay in your body for about 5 to 7 days. So you need to do about 5 half-lives to get a patient off a typical pharmaceutical. You don't want to pull somebody off an SSRI drug right away, because the rebound effect of that is the symptoms of why they were taking the drug in the first place. So they think that their problems are coming back, but really it's a side effect or withdrawal coming off the drug.
Now, with all this diagnostic testing and one-on-one things, how are you able to treat people over the phone? This telemedicine model.
We call this home but not alone. And I can have very extensive questionnaires sent to a patient, so I have a very good idea what's going on.
I mean, you
with
work
them.
with patients over the phone
All the time.
on getting them out of pain?
Getting them out of pain, helping them with their health-related issues that can be haunting them for decades.
And it works. You have results? You see results?
You know, through our website, I've been able to not just be locally, but international. And I get great results with people that, I mean, I have a whole book through testimonials for patients that are very satisfied with the care that they received online.
We are completely out of time. The pain patient watching this, they're in pain. They're skeptical. They hear you talking about a lot of things here. What do you say to them?
That there are alternatives. Chiropractic works unbelievable. It's safe. It's effective. It doesn't hurt. You don't become addicted. Using chiropractic to relieve pain and then targeting it with some very specific nutrients that control inflammation, prevent further free radical damage to your joint cartilage, and then very specific nutrients to cause cartilage regeneration is really the program that can get patients well and out of pain forever.
What about the person that says, how come my doctor is not combining nutritional therapies with my pain management?
Well, I hate to sound cynical, but there's not a large advertising budget from the pharmaceutical industry to give nutrients to medical doctors to teach them. I mean, the name of the game is that pharmaceuticals rule the world, and we would like every patient to be on drugs. And that's not my philosophy, but unfortunately, a lot of the medical doctors that are in my community do not feel like they're doing right for the patient unless they're writing a prescription. And I submit to you that it's different, that there are alternatives out there, and there are nutraceuticals and nutrients. Just by fish oils alone, there's 31 different studies on fish oils reducing inflammation in the journal of circulation.
Okay, where does somebody get started? They say, okay, Dr.
Well,
Banks,
they need to
I think is
contact
onto something here.
They need to contact us by calling the office, or they can contact us through the internet, through the website, and we'll send them out a new patient packet, info pack, and once we get an intake in, we start.
What is the toughest concept of all the things we've talked about when it comes to philosophy and approach to pain management that you have a tough time maybe getting across to the patient?
The toughest thing is that pain and symptoms are the last thing to show up in any disease process and the first thing to leave. So I'd much rather patients come in when they're feeling good than when they're really hurting. Think about it. By the time you have a heart attack, that heart disease has been going on for 40 years. By the time you have pain from a cavity, that cavity could be going on for months or years before you have pain. And the same thing with your back. By the time you have pain, that's the last thing to show up. And patients don't understand that because we're a very pain-oriented society. But I submit to you that it's different, and I much rather see patients when they're feeling good than when they're really hurting.
What if somebody watching this says, this sounds complicated?
We've taken the complication out, we've simplified it for patients, I make it very easy. You
give them printed materials, you lay out a program?
I have a tremendous amount of software, and we have the internet now, so we can print out things for patients in a jiffy for anything that they really need very, very quickly, so that they become educated in a short period of time.
Great. I want to thank you for coming on the show. Very interesting.
Thanks for having me, Randy. I appreciate it. It was great being here.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like information about future airings of this program or other show topics, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.